Welcome to Introduction to Mental Health Nursing. What is mental health? Mental health is a successful adaptation of body, mind, and spirit to the external environment. It is the adjustment of your body, mind, and spirit to the reality. Mental illness, loss of equilibrium of body, mind, spirit with the environment. As I told, mental health is the adjustment or adaptation with the environment. When that adjustment or that balance or equilibrium is lost, then we can say it's mental illness. Mental health nursing. Mental health nursing is a specialized area of nursing practice that deals with the promotion of mental health, prevention of mental illness, care and rehabilitation of mentally ill individuals, both hospital and community. So, mental health nursing means it is a specialized area of nursing practice. That practice include promotion of mental health, prevention of mental illness, then care and rehabilitation of mentally ill people. And we provide all this care both in hospital and community. Let's see what is therapeutic communication. Therapeutic communication is an important part in a nurse client relationship. Therapeutic communication means it's a communication process which is used for the treatment or for the progress of the client. As it says, this communication is therapeutic in a way. There are different phases in therapeutic communication. The first phase, or we can say this phase, is nurse client relationship phase. The first phase is pre-interaction phase. In this phase actually start before meeting the client or the patient. In this phase, we have to avoid stereotypic thinking or bias or any other type of false belief related to client. You have to avoid all these things. Pre-interaction phase means before meeting the client. Orientation or introductory phase. This is the second phase. In this phase, we introduce ourselves to the client. Then together we plan for patient's goals. We plan patient's goals with the patient. Third one is working phase. In this phase, we work with the patient to achieve the goal. We implement all our plans to achieve the goal. That is working phase. Termination phase means when we feel that we achieved the goals or approximately we reached that goal, then the termination phase is starting. In this termination phase, we are almost going to separate from the client. Actually, this termination phase start when the orientation phase is starting. So the termination phase start in the orientation phase itself. When you meet the client for the first time, that time itself the termination phase start. Lot of clients and nurses faces problems in the termination phase. So as a nurse, we should be careful during this termination phase. Let's see some of the process of therapeutic communication. The first one is sender. Sender means who sent the message. Second is message. Message means information. Third one is receiver. Receiver who received the message from the sender. Fourth one is feedback. Feedback means the receiver, after receiving a message from the sender, he gives some feedback back to the sender. So for a better communication, we have to clear all these four processes, and any defect in all these four processes will affect our communication. Let's see some of the therapeutic communication techniques. These techniques is helpful for a therapeutic communication or to understand or to make a good communication with the patient. The first one is broad opening statements. Broad opening statement means it will set a direction. When you ask some questions, it will set a direction to which way the conversation or the communication will go. Example, if we ask to the client, is there something you would like to talk about? It's a broad opening statement. You are setting a direction. You are opening a statement so that the patient will encourage to talk about his problems. A second technique is using general leads, which means if you use the words like yes, these type of leads or these type of words will encourage the patient to continue. Patient will think that yes, my nurse is understanding me or she is interested to hear about me. So this is called using general leads. Reflecting. Reflecting means part of patient statement is repeated. When patient is saying something, you repeat, okay, then what happened? Okay, when you went there, or what was the problem that time? Like that, when you repeat the patient statement again, so patient will think that yes, my nurse is interested to hear from me. That is reflecting. Sharing observation, that is the fourth technique. Sharing observation means nurse share her observation of the patient behavior with him. It means that when patient is talking with you, sometimes patient may have some type of shivering, or patient may feel you feel upset. So you can tell the patient like you seem upset, or you are fearing, or you are shivering. So all these things what you see in the patient, if you share with the patient, this will encourage the patient to continue about to talk about his problems again more deeply. Using silence, sometimes we have to use silence as a technique so that patient think that yes, she really understand, or she really understand my feelings and she wants to hear more about from me. So using silence is another technique. Then clarifying, sometimes if you ask the patient that I didn't understand, please clarify, which means that the patient will think that yes, the nurse is really interested, that is why she is asking more and more. Sometimes some nurses, what they do, they simply listen. They will not ask any question, or they will not any ask any clarification. They simply listen. So automatically the client will think that okay, the nurse is not that much interested in my stories. So if you use this clarification, if you ask the patient I didn't understand, so again patient will get more encouragement. Exploring, sometimes you can ask the patient, tell me more about that, explore or explain. So this is the another technique. Then giving informations will help client for taking decisions. There are some non-therapeutic communication techniques. So when you use therapeutic communication techniques, think that only give a good therapeutic communication techniques. Do not give non-therapeutic communication techniques. If you give non-therapeutic communication techniques, it will affect your communications. What is the non-therapeutic communication techniques? First one is providing false assurance. Then stereotypical comments passing. Then stereotypical comments means always you are telling the same comment. Yes, okay, okay, okay. These are stereotypical comments. Then giving advice or approval. Never and ever give advice to the patient. So if you give advice, it is like a non-therapeutic communication. Then asking the patient why. Do not ask the question why. Sometimes when patient is telling about some of his incidents, some of his activities. Do not ask the patient why you did that, because there will not be any proper answer, and it will hamper or it will block the communication. So after that the patient will not be interested to talk with you. So do not use the word why, asking the patient why. Then do not challenge the client. Then do not change the subject. When patient is talking about you something, listen and go through that. Do not change the subject. If you change that subject, the communication will not be proper, or it will not progress in a good way. So these therapeutic communication techniques and non-therapeutic communication techniques is important. For any exam, for any nursing exam, there will be a question or some questions from this topic, therapeutic and non-therapeutic communication techniques. The question will come like this, that they will give some, you can say, they will give you some incidents, like the nurse told like this, or the patient told like this to a nurse. So what will be your response? So always try to select the therapeutic communication techniques. So when you give the option, okay, when there is an option, there will be communication techniques will be there, and non-therapeutic communication techniques will be there. So always take the therapeutic communication technique. Example, sometime the question will be regarding incidents. The patient told the nurse so and so. So as a nurse, what will be your response? So in that response there will be four options they have given. These four option, in that four option, there will be non-therapeutic techniques reply and therapeutic techniques reply. So always try to get the proper therapeutic communication technique reply, and that reply should be matched with the incidents. You will get more questions related to this type of communication techniques in the future part. Let's see the other topic, personality development theories. First of all, we can see Sigmund Freud personality development theory. Freud is known as the father of psychoanalytical theory. He classified personality into three components. The first one is it, id, it. It means it is based on our drives. Whatever you feel in your mind, it is it. It never see the reality. There will not be any rationale, any, you cannot justify your drives or your thinking. So whatever you feel in your mind, it is called it. It always work on the basis of pleasure principle. Whatever the drives, maybe it is sex drive or maybe other type of drives, whatever it is, whatever you feel in your mind, it is it. Example, when you are walking on a street, you find or you saw a beautiful lady. So automatically sometime there will be an attraction, or you may think that I will go and approach the lady. So it is called it. It is called it. It may happen in your mind. It is called it because it is always pleasure seeking principle. But you may not go and approach that lady because you will think about the society, you will think about other moral values, etc. But if that type of thinking is coming in your mind, it is called it. Second is ego. Ego means it maintains balance between it and super ego. It works on the basis of reality principle. So ego means, as I told before, an example, like when you see a lady, in your mind there will be a desire to go and approach the lady. But I told you that that time you will think about your society, moral values, others, family. So you may not go and approach the lady because you know that it is not socially acceptable. or it is not good to go and approach a lady and tell what you want, or what you feel in your mind. So what you will do, you will not go and tell this thing. So it is called ego. You will postpone that thing. It is called ego. Super ego means it includes values and morals. It works on ideal principles. Superego means, yes, when you see a lady, when you are walking, when you see a lady, as I told, that your mind will have a desire to go and approach the lady. It is called it. So by thinking about the society, you will postpone that thing, or you will maintain a balance. That is called ego. You will not go and approach. You will think that, okay, this is not the good time to talk with the lady. I will talk with her when I get a good opportunity. That is called ego, because it will maintain a balance between your it and superego. It will see the reality principle. But when it comes to superego, in superego always consider values and morals. Superego will tell you that no, this is not a moral thing, this is not a good thing to go and talk with a lady. It is bad thing. So that is superego principle. Superego, if the superego is more in your personality, then you will consider more about values and morals. You will be a perfectionist person. If ego is more in your, if ego is more in your personality, then you will always find a balance. You will not do everything on a sudden desire. You will always think when to do, how to do, or you will postpone all those things. If it is more in your personality, if it is more in your personality, then you will do whatever you want. You will do whatever is coming to your mind, because more it is in your personality. So a personality is composed of three things: it, ego, superego. So for a good personality, we need this it, ego, superego in a balanced manner. If it is more in your personality, then you will do whatever you want to do. Like the thieves or the people raping other ladies, they have more it. They don't know how to control their it. So whatever is coming to their mind, they are going and doing. If superego is more in your personality, then you will be a perfectionist person. Like you will not do anything, you will not do any bad things. You will tell it is against morals, it is not good thing. So this is called superego. So Freud, he told that the personality is composed of three components, and his stage of personality development theory says there are different stages in your personality development. There are different stages. In every stage, there is a type of development, personality development is happening. He says that the first stage is oral stage. Oral stage. Oral stage is from birth to 18 months. Birth to 18 months. So this stage is called oral stage. In oral stage, the person or the baby, he feel pleasure in the oral area. He feel pleasure in the oral area. Uh, so if the baby is not getting the pleasure or adequate pleasure in from this oral area, or if the baby is not satisfied his oral stage, that is what I mentioned here, unsuccessful task completion. If the baby is not satisfied with or at the oral stage, then patient may or the client may go for alcoholism, smoking, nail biting, difficulty in trusting. These are some of the problems happening if there is unsuccessful task completion. In the oral stage, the baby will use mouth and tongue to deal with anxiety to get pleasure. That is why it is called oral stage. So if the baby is not using, or if the baby is not satisfied within the oral stage, these problems may happen. From 18 months to 3 years, the second stage start, which is anal stage. In anal stage, the baby use muscle control in bladder, rectum, and anus, and it feel pleasure during these areas, anal area. So the pleasure is located in the anal area. That is what it is called anal stage. If the baby is not getting the pleasure in this stage during this time, patient may in the future time the patient or the baby will have constipation, OCD type problems. Third one is phallic stage. Phallic stage start from 3 to 6 years. In this stage, the baby learn sexual identity. The baby knows that gender identity, who is male, who is female, and aware about genital areas as the source of pleasure. He knows that is the male and the female is different. They have different genital area. So these are the phallic stage. If any problems happening in this phallic stage, then in future the person may become homosexual or sexual identity problems. The next stage is latency stage. In this latency stage, the baby is or the person is learn how to socialize with the society. If any problem is happening, there will be an inferiority complex or lack of motivation for the person. 12 years to adulthood, which is known as genital area. In genital area, if the person is not satisfied with the genital area, or if the person is not getting pleasure from the genital area, in later the person will have impotence, premature ejaculation, etc. The another important personality development is by Erikson's psychosexual development. Erikson says that different stage. The first one is infants. Infants start from birth to 18 months. He says the characteristics of this stage is trust versus mistrust. Trust versus mistrust. In this stage, the baby view the world as a safe and reliable. He believe everyone. The baby believes everyone. He views the world as a safe and reliable one. So if the baby cannot think like that, then in the later period, in future, patient or the baby will have the problem of suspiciousness. He will doubt everyone. He will doubt every relationship. He will not believe everyone properly. The second stage is toddler. It starts from 1.5 to 3 year. In this stage, the characteristic is autonomy versus shame and doubt. In this stage, the baby feel a sense of control and free will. He need freedom. He need freedom. If he won't get that, there will be low self-esteem and dependency in the future period. Third stage is preschooler. It starts 3 to 6 year. Initiative versus a guilt. Initiative versus a guilt. Here the baby or the person start to initiate something. He will do, or he try to control his anxiety. He try to control his problems. That is called initiative. If he cannot do that, he feel guilty. So if he cannot do this time, in future the personality will be like a passive personality. Passive personality means if somebody is saying this is true, he believe that, or he always depend other. Always he will have strong feeling of guilt. So this is the third stage, initiative versus guilt. Initiative means the patient or the baby will start to manage or control his or her problems alone or on. without depending others. Then scholar start from 6 to 12 years. In this age the characteristic is industry versus inferiority. Industry means here the patient will have confidence and on ability to do something, that is industry. And if he cannot do that, then in future period the patient will have inferiority problem, lack of motivation problem, etc. Adolescence, identity versus role confusion. Adolescence start from 12 years to 19 years. Here identity versus role confusion. So here the person will think a sense of self and belongingness, and he will start to do some relationship. And if he cannot identify himself, or he cannot identify his values, then later it will lead to substance abuse problems or keep problems in maintaining personal relationship, etc. So this adolescence year is important for social relationship. He identify himself and with the others, he identify his feelings. Next stage is young adult. It start from 20 to 40 years. It include intimacy versus isolation. In this age the person start loving relationship and other attachment or relationship with others. If he cannot do this, then in future there will be issues in relationship. Next stage is middle adult. It include generativity versus stagnation. In this time a person will become creative and productive. He will think about his family, he will guide next generation, and if he cannot do that, unsuccessful task completion in this stage will lead to problems like selfishness, and the person will not concern for others, he will not think about others. The last stage is maturity. Maturity start from 65 to until death. It includes ego integrity versus despair. So in this age the person will think more about life. He will accept the responsibility of one's self and life. If he cannot do that, then he will have hopelessness, issues of aging, etc. So these are the some of the personality development theories. Most of the time questions were asking regarding these stages. Erickson's psychosocial development infant stage start at what time, or what is the characteristics of infant stage? Is it trust versus mistrust, or autonomy versus shame and doubt, etc.? Or sometimes the question may come, initiative versus guilt is found at what stage? Next we can discuss about defense mechanism. What is defense mechanism, or ego defense mechanism, or ego mechanism, or coping mechanism, whatever it is? In short, defense mechanism means, as we know, our mind is so delicate. It is like an egg. If any anxiety or any problems happening, your mind will not feel good. But by birth or by God grace, we have a skill or ability to maintain or to reduce this anxiety. Somehow we will manage to reduce this anxiety. So if when you get a problem, automatically your mind will have anxiety, or your mind will have lot of disturbance. So your mind itself will try to reduce this problem, to reduce this disturbance, or to reduce this pain. So this mechanism is called as defense mechanism. So in simple way, I can say defense mechanism is to promote a self-esteem or to cope up with the situation, to reduce the anxiety which is happening because of some unpleasant thoughts or ideas. Example, when you fail in an exam, your mind will have lot of disturbance. You feel pain. So somehow you will try to reduce this pain or reduce this disturbance. So these mechanisms known as defense mechanism. There are different defense mechanism we can use. We'll see about one by one. The first one is compensation. Compensation means consciously covering up a weakness by a strength, which means that suppose if you fail in studies, one student he fails in studies, he is not good for studies, but he became the college champion in athletics. So think about it. The person is having low mark in exam, so automatically his mind will feel bad. But how he compensate that problem? He becoming the athletic champions. When he become the athletic champion, he can compensate or cover this weakness. So his mind will feel good. So this is called compensation. Next is suppression. Suppression means consciously forgetting a painful thought, consciously forgetting a painful thought or event. You are consciously forgetting a painful thought. Example, you had a accident. So when you think about that accident, your mind is getting pain. So you are consciously forgetting that event. That is suppression. The third one is repression. Repression means unconsciously forgetting a painful thought or event. So the difference between suppression and repression means suppression means consciously, repression means unconsciously. You are forgetting your dear one's birthday after a fight. You are forgetting your lover birthday after a fight, because when you think about that fight you feel painful. So you are forgetting about everything about that lover. So forgetting a loved one's birthday or lover birthday after a fight is repression. It is unconsciously you are forgetting, because when you think about it, it will give you pain. So you are unconsciously forgetting about that event or thinking. That is repression. Denial. Denial means refusing or denying unpleasant idea or thought. You will refuse. You will refuse. Suppose the after a diagnosis, one man came to a hospital and the doctor diagnosed him as cancer patient. He knows that he is having cancer, but he thinks or he tell himself or he believe himself that he is not having any problem. Even the doctor show him the diagnostic paper or all reports, still he will not believe that he is having cancer, because he refuse all these things. Because when he admit that he is having cancer, he will have pain in his mind. So what he is doing, he is refusing or denying. That is called denial. Then the fourth one is displacement. Displacement means unconsciously displacing feeling to a less threatening object. Unconsciously you are changing your feelings to a less threatening object. Suppose in an office, your boss, he scolded you. Boss scolded you. And you cannot scold him back, or you cannot show your anger to him because he is your boss. So what you are doing after going your home, you are showing this anger everything to your wife. So this is called unconsciously displacing feeling to a less threatening object. Always think about it, less threatening. You are showing not to your boss, because boss is superior to you. You can show your feeling anger only towards your wife, because wife is inferior or less threatening. Wife will not do anything. If you show your anger to her, she will not beat you or do anything. You know that. That is why you are showing your anger to your wife. When wife is getting any scolding from husband, what she does, she cannot scold or show her anger to husband, because in some situation it is husband is superior. So what she does, she shows her anger on her baby, because baby is less threatening. Baby will not beat mother. She knows that. That is why she shows all her anger towards baby. So all people, they are what they are doing, they are displacing or changing their feeling to a less threatened object. Next is reaction formation. Reaction formation means showing behaviors and attitudes opposite what one really feels. You are showing behavior or attitude opposite to what you feel. Example, uh, a person who actually hate another man. He actually hate another man. Or example, one lady, she is working as a stenographer in an office, and she likes her boss. At the same time, she hate boss wife. She likes boss, at the same time she hates boss wife. But when she saw wife boss wife, she shows lot of respect, lot of love towards boss wife. Actually she hate that lady, but when she saw this lady, she is showing lot of respect and love, which means that she is showing opposite reaction. That is reaction formation. You are showing opposite behavior. That is called reaction formation. Rationalization. Rationalization means justify failures and unacceptable behaviors. It means that you are justifying your failures. Suppose a surgeon was doing an operation, and the patient had become more sick, or the operation was not successful. So what the doctor is doing or the surgeon is doing, he is blaming others, or he is justifying his failures. It is not because of my fault, it is because of the nurse fault the patient became sick. Or other thing, you can say that a student, he is getting a low mark in chemistry, so automatically he will feel bad because his chemistry mark is not good enough. So what he will think, he will rationalize or he will justify his failure. He will tell that my chemistry teacher is not good in teaching, that is why I got low mark. It is not because of my fault, it is because of teacher fault. Or sometime in some other case they will give some reason. As I had fever, I couldn't study properly. That is why my mark is low. So they always find some justification or rationalization or reasons for his or her failures. That is rationalization. Next is intellectualization. Intellectualization means the person will think more intellectually. He will not show any feeling or emotions, even though he knows the fact. Example, wife after wife death, The husband is not showing any emotions or feeling. He knows that his wife is not more. Still, he will not show any emotions. He will not cry any emotions. What he is doing, he is thinking in his mind that life is like that. He will think intellectually. Life is like that. Everyone has to go to this destiny. Everyone will die. It is a fact. I have to accept it. He will think more intellectually and will not show any emotions. That is intellectualization. Next is regression. Regression means unconscious return to an earlier and comfortable development stage. An adult, when he is getting any problem, he will act like a child. He will go to an earlier and comfortable stage, development stage. Example, you may be seen in films when there will be a love failure, the girl will go to the bedroom and he or she will sleep like a baby. So when problems comes, when there is some problems comes, the person will go to the previous development stage, go to the child stage or infant stage or something, because he or she feels more comfortable at that stage. Unconsciously she is becoming like that. That is called regression. In some films we can say, sorry, we can see that after an accident or after any death of anyone, the hero or heroine becoming like a baby, or she is or he is acting like a baby. That is called regression. Next is undoing. Undoing means consciously doing something to make up the wrong action. Suppose you do a wrong action, you beat your child. So after that you feel very bad because you have beaten your child. So you will give some gift or treat, thinking that when after doing this thing, my mistake will be uh, will be cover up, or it will not be there. So to consciously you are doing something to make up your wrong action. After doing some mistake, people will go and go to temple or church and giving some offerings there. These are called undoing. After doing this thing, their mind will feel a relaxation. So this is called undoing. Next is disassociation. Disassociation means blocking of unpleasant thought or events from conscious mind. Like you will block all unpleasant thought or events from the conscious mind. Example, somebody, one girl, she had a rape when she was child. She was child, she had a rape. Somebody raped that child. But but she will not, after becoming adult, she will not remember anything about that rape, because she is blocking that thought, that event from her conscious mind. That is called disassociation. Means she remembers nothing about the childhood sexual abuse. She cannot remember that thing. That is disassociation. Next is substitution. Substitution means replacement of an object with another object more acceptable to the ego. We will replace one object with another object. Suppose one person, he had a desire to become MBBS doctor, but he couldn't. So what he did, he joined nursing or BDS, which is near or acceptable to his mind. So that is called substitution. Substituting one thing with another one. Who some person who was not able to become a doctor, they are becoming nurse. Next is conversion. Conversion means expression of emotional conflicts through physical symptoms. Conversion means when a person is having some emotional disturbance, he will he will express, or he will have a lot of physical problem. He will think, he will have headache, or sometime body ache, abdominal pain, etc, etc. This is called conversion. Projection means blaming others for one's mistake, always blaming others. As I told before, when a surgeon, when the surgeon, uh, uh, after an operation, if the operation was not successful, the surgeon blames a nurse. That is called projection. Sublimation means channeling unacceptable behavior into acceptable activities. Suppose a person uh, who is having more aggressiveness, more energy, he always used to beat somebody, always beating somebody, always in fighting. So it is not a good behavior. So changing or channeling this behavior into acceptable activity, like he joined in a boxing club and he become a boxer. It is a acceptable activity. He become a boxer. So this is called sublimation, means changing an unacceptable behavior into a acceptable behavior. So these are some of the defense mechanism which we use to control our anxiety. As I told, our mind is like an egg, very delicate. So whenever you get a problem or disturbance, your mind will feel more pain will be there. So automatically your mind will tries some ways to reduce that pain. There are different mechanisms your mind is using to reduce this pain. This is called defense mechanism. So these are some of the defense mechanisms, techniques. So for the exam, they will give some incident or situation and they will ask what type of defense mechanism is this. They will give three or four options, so you have to select the proper defense mechanism. They will give you one incidence or one example, and they will ask what type of defense mechanism is this. So just read this defense mechanism and just understand with some example, then it will be very easy for you. Thank you.